welcome to the Rapid Recovery Programme.
Here at Wrexham Maelor Hospital, all elective knee surgery patients will join the Rapid Recovery Programme. As a patient on this programme, you'll follow a structured pathway of care. You'll be fully involved in your recovery and back home as soon as possible after your surgery. That's normally within 3 days. Our orthopaedic team developed this film to help prepare you for surgery. It should teach you what to expect and what is expected of you while you're in hospital. It should also help your continued recovery at home. Before surgery, you'll attend a pre-operative assessment clinic where the nurse completes a general health assessment. You'll also be seen by a pharmacist to review your current medications. The pharmacist will instruct how to take your usual medications before the operation. You'll also be invited to attend the joint school. Attending joint school is an important part of your rapid recovery care journey. There you'll meet with clinical staff involved in your care and recovery process. The information will help get you mentally prepared for surgery, so you understand what's involved and, importantly, how you can help yourself to recover more quickly. You'll also meet our patient representative. They'll share their personal experience, giving you advice from a patient's perspective. They'll explain how the procedure will benefit you, how their quality of life was enhanced after surgery. The most common difficulties experienced during the recovery process will also be discussed, with suggestions on how to overcome them. Patients are encouraged to ask questions at joint school. This is a great opportunity to clear the air. It's also important that you bring along a partner, friend or relative who'll be there to support you as your coach during your continued recovery at home. Information booklets and exercise sheets will be given to you and your coach so that you can start to practice your stretches. It is important to keep yourself as fit and healthy as possible before surgery. If you smoke, do try and quit for a few weeks before and after the operation. It's best to quit at least 12 weeks before, but quitting at any time before your operation will really help you recover. Keep mobile. Strengthening the muscles around the joint will aid your recovery, so you should try and stay as active as possible before the operation. Keep up with gentle exercise like walking and swimming. There are some exercises on this DVD which you can start to practice before coming to hospital. Eat a healthy diet leading up to your operation. If you're overweight, it's important to lose weight in preparation. This will help reduce any risk associated with anaesthetic, and your new joint may last longer. Make sure that you're in the best physical health before surgery can go ahead. The occupational therapists aim to understand the link between you, your environment, and your daily activities. To prepare for surgery, you should address these individual areas to maximise your independence during your post-operative rehabilitation. Make things easier and more accessible in your home. For example, bring items out of cupboards onto the worktops. Remove any potential trip hazards such as loose rugs. Daily living activities will be assessed and discussed with your occupational therapist. If you've any concerns, please talk to the occupational therapy team when you come into hospital. On the day of your surgery, you'll come to the arrivals unit, a dedicated area for people awaiting operation. Don't forget to bring your medication with you. There, the arrivals nurse will book you in and get you ready for surgery. It's important that your coach, family or friend is prepared and transport arrangements made. Please let us know on arrival if you've any problems with transport for discharge. A consultant will discuss the anaesthetic and pain relief method most suitable for you. Information about the different techniques will be given at the joint school. The consultant will discuss this during the consent process before your surgery. The occupational therapist will talk about your home environment, discussing any support needs you may have. You should start to think about any difficulties and any concerns you may have about returning home. It might help to write these down and bring them in with you. The physiotherapist will reinforce the information given at joint school regarding your expected post-operative rehabilitation programme. Your pre-operative mobility status will be assessed and you'll be taught potential walking techniques with the most appropriate walking aids. They'll show you how to negotiate stairs or steps if necessary, and they'll identify a preferred hospital for your follow-up outpatient physiotherapy appointment. When it's time to go to theatre, the arrivals nurse will escort you into the anaesthetic room. Once you're there, final pre-surgical safety checks will take place. This is to make absolutely sure that you're the right patient and the correct joint has been identified. The anaesthetic will then be given. Whilst many patients do have general anaesthetic, where you're fully asleep during surgery, an increasing number, like Sydney Hall here, choose a spinal anaesthetic. This means you'll be awake and able to talk to the operating team during surgery. In theatre, the surgical team wear full protective equipment. This will help prevent infection. As an important part of the programme, the surgeon will apply a special mix of drugs around the pain receptors of your knee. This will help make sure you're as free of pain as possible and able to mobilise more quickly and easily afterwards. During surgery, the anaesthetist will be there to monitor you. If need be, they'll vary the anaesthetic appropriately to keep you comfortable. Once surgery is complete, a compression bandage will be applied to support your knee. You will then be taken to the recovery area where you will be closely monitored until you're ready to go back to the ward.
Hello, my name is Senior Sister Cheryl Frew. I'd like to welcome you to Prince of Wales Ward. Prince of Wales Ward has been acknowledged by the Welsh Assembly Government as a centre of excellence for our enhanced recovery programme for total hip and total knee replacement surgery.
A physiotherapist will visit you on the ward. They'll teach you to exercise to increase the range of movement and strength of your new knee. They'll also ensure you can walk safely with an appropriate walking aid and that you're able to climb up and down the stairs or steps if need be. To optimise your progress, it's very important that you continue to exercise independently at home between visits by the physiotherapist. An occupational therapist will repeat an assessment of your day-to-day activities. This will help identify whether you need any further support so you can continue to carry out routine tasks safely back at home. This will include making sure you can get on and off a bed, chair and toilet. They'll also talk about washing and dressing techniques, and if necessary, safety within the kitchen can also be addressed. Everyone is different. We all have different needs. Your occupational therapist will assess you on an individual basis. Any support aid or piece of equipment needed will be given on the ward for your coach, friend or relative to take home. You'll be normally discharged 3 days later when the clinical team is happy with your progress and you meet the following criteria. You've been assessed by a physiotherapist and deemed safe to walk with crutches or frame and able to manage stairs or steps if necessary. The strength of your knee and range of movement is improving steadily and you're able to perform your exercise programme independently at home. You've been assessed by the occupational therapist and given the right equipment to make sure you are safe at home. You are confident and understand how and when to take your medications. You'll be given a contact card with telephone numbers for support and advice.
Morning, Mr. Carson.
Good morning.
How are you?
I'm doing all right, thank you.
A district nurse will visit you 2 or 3 times after you've been discharged. They'll make sure that your wound is healing well, that you're coping, and check that you're making good progress.
That's right, yeah.
They can also support you through signposting to other services, which you might find useful, and act as a link to the clinical team if you're having any particular problems. The aim of this rapid recovery programme is to get you back to the activities and hobbies you enjoy as soon as possible. Like Philip Carson, you can help ensure your replacement is a long-term success by continuing your exercise programme.
But because it is a great motivation to actually get back and be able to get back into your hobbies and enjoy things, you know. It's a pleasure.
We hope that this film has helped you understand the basics. The staff are here to help to make your experience the best it can be. But a positive frame of mind is vital for your recovery.